If ever it happens, how do we have to act in front of this pain? If the chest pain is constructive, median, retrosternal, and specially repeats, if it's calmed down in a few minutes, then you need a medical consultation as soon as possible to limit the growth of the atheroma plaques if the pain is caused by the atherosclerosis. On the other hand, if this chest pain is persistent for more than 20 minutes, whether repeated or occurring suddenly, it is an emergency. You should immediately go to the hospital. And please always remember that if you exceed the 6 hours, it will be a forever heart damage with heavy consequences in life. If the chest pain only occurred during physical activities, also it is necessary to do a medical consultation to be sure of the origin of this pain, to control your risk factors in a way to limit the disease, and to discuss with your doctor the solution possible to these discomforts. And we come to the end of our course. I'm so happy that you have followed it with me till its end. I hope that I was clear in that I simplified for you this disease so you can be aware of its gravity and prevent its occurrence. Thank you so much for your trust, and if you have any questions, please don't hesitate to send them to me. Also, if you have any suggestions for medical subjects that interest you, please let me know them. Thank you again, and see you in the next courses.